बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि अलैहि। Dear colleagues, this is a female child, almost 5-6 year old, with history of off and on abdominal colic uh, for the last 2 or 3 days. One day before, she developed vomiting and loose motion. Now there is no vomiting and no loose motion. However, she is having intense colicky pain in the abdomen uh, within, for the last 2-3 days. This pain is episodic, remain for few seconds or few minutes, then it subsides, and then again after a couple of hours it again develops. So I'm going to scan the abdomen. Here we can appreciate the whirling sign at the left paraumbilical region. I'm using the convex probe, so I look here. This is a mass which is showing whirling sign. I'm going to put the color. The mass is having vascularity at its periphery, or it is showing vascularity as these echogenic areas. Look at here. So now I am at the supraumbilical region, just below the epigastrium. There is another mass with whirlpool appearance. We can also say it is a onion peel appearance, and these are the echogenic foci with dirty posterior shadowing, and this, I think this is the gut loop. I will see it in the linear probe. Now I am following this mass. I am going downward. I have reached the umbilical region. I am again going downward. I have reached the mid pelvic region. Here it is not visible, so I am going to check it on the sagittal section. So I have put the probe in sagittal direction. So it means this is the gut loop which has such appearance, and on the left paraumbilical region, this was another whirlpool appearance mass, this one. So I'm going to check it on the linear probe. So here we can appreciate this one, and if we check these one, this one linear structures are present. This one within the lumen of gut loop. So these are the worms. These are the tapeworms, or maybe these are too much lengthy, and they are multiple in number within the lumen. Look at here. So these are, look this one. So these were the, look this one. They are moving with the lumen large enough. Look at this one. And this was a gut loop which was extending from the epigastrium to the pelvic region. This is also full of worms. These are the these are so this female small child has, look at this one, plenty of multiples and numberable. We can't count these worms which are long enough, tapeworm and other such types within the lumen. These may cause obstruction. Look here. They have made the home in the lumen of the gut, and they are causing trouble to this female child. And lymph nodes are also present. So this was the actual cause of intense colicky pain in this female child. So in conclusion, this patient is having worm infestation settled within the lumen of the small bowel. Such a big and long worms. Thank you very much.